Isa meets with Ketsia and they go together to Rukura Health Center so that Ketsia can have her first antenatal care visit at the health center. There they meet with Yvonne, who will be Ketsia's midwife. Yvonne finds Ketsia in Iheza, and once she finds her name, she is able to see all of the information that Isa has already entered into Iheza in the community. Here you can see the last menstrual period is already there. We confirm that that is the accurate date, calculates the estimated due date and gestational age. And then Yvonne conducts a thorough obstetrical and medical history. She asks about the number of at-term deliveries. She's had 2 live births at term, 1 preterm delivery. She's had no stillbirths. She had 1 miscarriage in the first trimester. She has 3 living children. She's had 1 C-section, and this was in the most recent delivery, and it was because the baby was breech. And you can see that any complications are highlighted in red and will also be listed on the progress report. She has not had any of these other complications in pregnancy, but she has had preeclampsia. She has not had gestational diabetes. We'll save this. And then we'll ask her about medical history. She has no underlying conditions such as diabetes or heart disease. But she did have tuberculosis in the past, and she was treated for this. And she has no other conditions. Save that. And then her partner came with her today. They provided HIV counseling to the partner and conducted HIV testing, and this was negative. Yvonne then conducts a physical exam for Ketsia. Her blood pressure is 120/80, and Ketsia's heart rate is 80. Her respiratory rate is 26, and this will be further evaluated in the lung exam, and her body temperature is 37 degrees Celsius. Ketsia is 165 centimeters. She's 55 kilograms. Her BMI is 20. And her MUAC, mid-upper arm circumference, slightly low at 20. Do a core exam, which is normal. We're looking for any signs of complications that could affect the pregnancy or indicate underlying complications or disease. No signs of anemia or preeclampsia. It's too early for the fundal height to be measured, and it's too early in the pregnancy to determine the fetal presentation or fetal movement. But Yvonne is able to hear the heartbeat of Ketsia's baby. The heart rate was 140, and she noted that she had a horizontal C-section scar. We're going to document 0 fetal fundal height for now. Yvonne conducts a breast exam and teaches her how to do a breast exam at home. They discuss the types of family planning methods Ketsia would like to use after delivery. She receives iron and folic acid and a mosquito net. And Yvonne reviews any danger signs for Ketsia's pregnancy. She has none. They review the progress report together. It lists any risk factors for the pregnancy, medical conditions, or current diagnoses like moderate underweight. It lists the heart rate that was noted for the first time. And we plot both the BMI and the fundal height once that is available. All of this is in English or in Kinyarwanda. And we end the encounter.